Is there anything I can do to get rid of dark spots caused by eczema?
So the dark spots that are left behind after eczema clears is something, it's a feature of eczema that primarily affects patients with skin of color. And it's just an additional challenge to the condition on top of the itching and the scaling and the redness and all the other typical manifestations of eczema. Once the eczema clears, there's a tendency to leave behind increased pigment. And that's because in skin of color, the pigment-forming cells called melanocytes are sensitive to inflammation and a variety of inflammatory factors that can turn on increased pigment production. So once the eczema clears, there can be a persistent dark spot that lasts for weeks to months. So when it comes to actually managing those dark spots, I like to start with prevention. So the cause of the dark spots is the eczema itself. So the better we can control the eczema, if we take a broad and holistic and aggressive approach to managing all the factors that contribute to eczema, we can reduce the severity and duration of the dark spots. So that's step one. But even with the best efforts, one still frequently gets a persistent dark spot after eczema resolves. And so in a scenario where the eczema has completely cleared but has left a patch of hyperpigmentation, we can employ various strategies to reduce that hyperpigmentation, including prescription skin lightening creams that might contain hydroquinone or non-hydroquinone based therapies that reduce pigment. We can very cautiously and carefully use procedures in the office, such as superficial chemical peels containing salicylic acid or glycolic acid, as long as the skin is completely intact and not inflamed and not involved with eczema. We can employ those strategies on top of topical skin lightening products. And finally, we can also carefully use some lasers to get at deeper pigment that's deposited in the skin as a result of eczema. But again, I hold off on any of those cosmetic procedures and skin lightening treatments until the eczema has completely resolved in that particular area. So controlling the underlying cause of the pigment, in this case eczema or atopic dermatitis, is the first step, and this is the most important key.